Good morning, everyone. Today, I'm going to present my topic of psychiatric disorders and its disability assessment and disability benefits. Hi, I'm Dr. Akash Chaudhary, first year resident of Department of Psychiatry, Chhatrapati Shivaji Subharti Hospital, SVSU, Meerut. Today, my topics first, I'm going to give you a brief what I'm going to speak about today through the index. Why there is a need of a disability certificate, legislation passed by the government, disability as Person with Disability Act and National Trust Act, what is disability, RPW Act, who should assess the disability, and the various psychiatric disorders under which we're gonna know how to assess a disability and how to give a validation or certificate for it. Disability due to mental illnesses and rights of a person with disability. So first of all, why do we need a certification? It's very important to know that being a part of having a psychiatric illness, the society is not readily open to basically accept the people who are undergoing through a mental problem. So there's a stigma attached to it. So if there's a certification, they can enroll into certain government programs for which we are discussing this topic. It helps in medical legal purposes, employee versus employer, to assess probable loss of functionality, to measure compensation as an authentic document for reasonable accommodation at public or workplaces, to know applicability at various state benefits, reservation academic and work opportunities for an inclusive society. The Rights of Persons with Disability Act, RPW Act 2016. The previous act has been repealed now. Important legislations. The Right of Person with Disability Act 2016, known as RPW Act 2016, National Trust Act 1999, and Person with Disability Act 1995, which has now been repealed. What is a disability? Disability, a difficulty in performing one or more activities which in accordance with subject's age, sex, and normative social role and generally accepted as essential. Ministry of Welfare, Government of India 1986, that's how they defined it. Now it's called Ministry of Social Justice. So there's a stark difference between the definition provided by the Ministry of Social Justice and one which was proposed by the United Nations Convention's Right of Personal Disability Act. According to them, disability results from the interaction between persons and impairments and attitudinal and environmental barriers that hinders their full and effective participation in society and equal basis with each other. So in the first definition, it is more of a structured definition regarding the functionality of the patient. It disregards the basic environmental barriers or attitudinal problems that a person might go through in a society. Example, if a patient is having a manic episode, so the co-workers also know that whenever the peak of the symptoms arrive, how he behaves. And the employer also knows that if he has the previous subsequent episodes like that, so there might be a problem for his employment future prospects, and the society looks at him from a very different lens, for which RPW Act 2016 was proposed, which has some modifications as compared to the one in 1986. Disabilities as per PWD 1995 and NTA 1999. Disabilities as per Act: blindness, low vision, leprosy cured, hearing impairment, locomotor disabilities, mental retardation, and mental illness. The National Trust for Welfare of Persons with Autism included cerebral palsy, mental retardation, and multiple disabilities. Autism, cerebral palsy, mental retardation, and multiple disabilities. RPW Act 2016. Under Section 2 of RPW Act, person with disability means a person with long-term physical, mental, intellectual, or sensory impairment, which interaction with the barriers hinders his full and effective participation in society equally with others. Persons with benchmark disability. So the word benchmark is important because this is further going to explain who do we consider as a benchmark disability in psychiatric disorders. Means a person with not less than 40% of specific disability, where specified disability mentioned in the section 2 ZC, specified disabilities are specified in the schedule, which is present in the next slide. So there are basically 21 different diseases which come under the disabilities as per a schedule of RPW 2016. Leprosy cured, dwarfism, cerebral palsy, muscular dystrophy, acid attack victims, blindness, low vision, hard of hearing, deaf, speech language disabilities, multiple sclerosis, Parkinson's disease, hemophilia, thalassemia, sickle cell disease, multiple disabilities, and locomotor disabilities. 18, 19, 20, and 21 are specifically related to psychiatry, which include intellectual disability, specific learning disability or SLD, autism spectrum disorders, and mental and behavioral and mental illnesses. The thing to note over here is that any other notified form time is basically new diseases can be added to it. Depends upon how it is notified and how new diseases are brought under the Disability Act. So people who are falling under these categories can get the benefits of the certificate issued due to disabilities. Who should assess the disability? Under Section 56, the central government shall notify guidelines for the purpose of assessing the extent of specified disability in a person. According to Section 57, the appropriate government shall designate persons having requisite qualifications and experience as certifying authorities. Guidelines for disability assessment issued on 4 January 2018 by Department of PWD under the Ministry of Social Justice. The state government union territory administrations shall constitute the medical boards. The DGS and Ministry of Health and Welfare will be the final authority in case of any clarification or dispute. Application and time frame for assessment. Rules for the implementation of RPW Act 2016 were issued under the Section 100 on 15/1/2017. Rule 17 to 20 under Chapter 7 deal with certificate of disability. Any person with a specific disability may apply in Form 4. Form 4 basically, there are basically 4 forms, and Form 4 contains the various disabilities that a person is going through. So it's a prerequisite and a must document that one should have at either competent authority of his area or residence where treatment has provided. Aadhaar is not mandatory, but if available, no separate residence proof is required. One residence proof is a must, but if somebody has an Aadhaar card, they do not need to attach another documents for the certification. Medical authority should issue a temporary or permanent or no disability certificate within a month of receipt of application. So the onus comes on to the authorities then. At the date when the certificate is issued, there's only 1 month period. Till then, they have to forward the document or the disability certificate wouldn't be issued. Issuance through online platform has to be notified. Various state governments has proposed the different ways of online participation so that they can apply for these certificates, which is still not so transparent and not going through as planned. First comes intellectual disability, a condition characterized by significant limitations both in intellectual functioning, which contains of reasoning, learning, and problem solving, and in adaptive behavior, which covers a range of everyday, social, and practical skills. How to diagnose intellectual disability. The screened children will be referred to child or clinical psychologists for adaptive functioning and IQ testing. The tools that can be used for the same include adaptive functioning is tested by a Vinland Social Maturity Scale known as VSMS, and IQ testing through 2 scales, Binet Kamat test or BKT, and Mallin's Intelligence Scale for Indian children MISIC. Severity of disability is checked through VSMS. So the thing to note over here is that severity can't be checked through the forthcoming illnesses that we're going to talk about. So it's more of a quantitative measure, which can be measured through intellectual disability using the VSMS. So this is a flowchart regarding how the things proceed. Parents, teacher, and complain of the poor understanding of a patient come towards the OPD. It is first assessed either by a pediatrician or neurological examination for any other comorbidities like hearing impairment or visual disturbances. Further domains affected and involvement of locomotor visual hearing abilities. It is assessed by psychologists or specific tests like VSMS and intellect. Then it is diagnosed. Severity of the assessment is checked again by VSMS scale. The board assesses and certifies it. A temporary certificate below 5 years of age is issued. So if somebody is diagnosed with age at 4 years, then the certificate will be only liable till 5 years. After 5 years, they have to go again and reapply for recertification at age of 5, 10, and 18 years. After that, they qualify for the permanent certification. Yes. 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 Disability calculation and medical authority. So according to the VSMS scale, 0 to if the child comes under the rating of 0 to 20, profound degree, 100% disability is diagnosed. 21 to 35, severity is 90%. 36 to 54 moderate or 75%, 55 to 69 mild for 50%, and 70 to 84 is borderline around 25%. The various benefits that a person with intellectual disability gets through these percentages. The gray area falls between if a patient scores just than 85 or below 83, is he regarded as borderline or healthy, or will he be issued a certificate for it or not? And if somebody comes into 53 or 57, the certification should be given for moderate or mild, because the benefits through the certificate that they are getting depends upon the degree in which they fall. So it is the area of discussion. Age criteria and certificate validity for ID. Minimum age of certification is one completed year. 1 to 5 year age children should be given the diagnosis of global developmental delay, not to be mentioned as intellectual disability. For children less than 5 years of age, validity duration 3 years or age at 5 years, whichever is earlier. Example, if diagnosed at 4 years, the validity will expire as he turns 5, which I have mentioned before. Children above the age of 5 years should be given the diagnosis of intellectual disability. The certificate has to be renewed at the age of 5, 10, and 18. The certificate issued at the age of 18 will be valid lifelong. Medical authority for ID assessment. Civil surgeon, CMO equivalent appointed by the government, a psychiatrist, clinical or rehabilitation psychologist, pediatrician or pediatric neurologist. Pediatric neurologist if the age is above 18 years of age. Specific learning disability or SLD. It's a comprises a group of condition where there is deficit in processing language, spoken or written, that may manifest itself as a difficulty to comprehend, speak, read, write, spell, or do mathematical calculations, and include such conditions as perceptual disabilities, dyslexia, dysgraphia, dyscalculia, dyspraxia, and developmental aphasia. SLD. The screening of the SLD is done through a team of pediatrician or clinical rehabilitation psychologist. Pediatrician should do detailed neurological, including vision and hearing assessment. This should be followed by IQ assessment by the clinical psychologist using Mallin's Intelligence Scale for Indian Children, or WISC-3, Wechsler's Intelligence Scale for Children. Only if the IQ is above 85, then SLD assessment should continue. If the IQ is below 85, then it can fall into intellectual disability category and they can avail the benefits through it. And if the patient qualifies of IQ above than 85, then an SLD is applied for it for other psychiatric illness as mentioned before. Methods of assessment and validity. National Institute for Mental Health and Neurosciences. A battery shall be applied for diagnostic test for the SLD. Basically, a patient has to go through a battery of tests for diagnosis of SLD. As now, it would give the presence of SLD or not, but won't be able to quantify the percentage of disability, like other measures meant for specific disabilities. Not readily available and may be obtained from NIMHANS. Only should be certified in children above 8 years with IQ above 85. Certification would have to be repeated at 14 years and 18 years of age. A permanent one be issued at the age of 18 years. Another caveat for this is that these are basically present only in three regional languages, Hindi, Telugu, and Kannada. We are not sure how the people through various states are assessing the basic learning disabilities that the people are facing through. So these can be procured from NIMHANS, and how to apply these skills, there's a special workshop that is being held after every 2 or 3 weeks, into which a psychologist can go through through a course, and he can assess the patient and will be helped to diagnose it better. Medical authority issuing for SLD, civil surgeon, CMO or MS, pediatrician or pediatric neurologist, clinical or rehabilitation psychologist, occupational therapist, or special educator. Teacher trained for assessment of SLD. Autism spectrum disorder or ASD. Autism spectrum disorders are lifelong neurological condition typically appearing in the first 3 years of life that is marked by the pervasive impairments in the areas of social skills and communication, often associated with hyper or hyporeactivity to sensory input. Unusual interest of stereotypical rituals or behavior like flapping of hands may or may not be accompanied by intellectual impairment. Autism disability assessment. Guidelines for evaluation of assessment of autism and procedure for certification by gazetted 25th April 2016 by the same ministry under the same act. This gazette contains three annexures: Incline Diagnostic Tool for Autism Disability, Indian Scale for Assessment of Autism, and Proforma for Issuance of Certificate of Disability due to Autism. Incline and ISAA tools. 12 questions about social interaction, communication, and restricted interest about childhood disintegrative disorder or Rett's disorder. If a score for the first 7 questions is 1 and 0, for 8 to 9, it would be autism. ESA scale is a scale with 40 items under 6 domains. The ESA has been developed, which provides the detailed assessment procedure and tools for assessing the extent of disability for persons with autism beyond 6 years of age. Early identification, early intervention. So it's a dilemma that books say that before, if you diagnose the patient as early as possible, the intervention is better for the patient if it diagnosed earlier. But according to this act, beyond 6 years of age, this gives the certification. So it's a gray area that at what age should a patient be certified for the specific disease. Validity. Based on the identification of cases of autism in terms of inclined tools, certification of autism on the basis of ESA tools can be issued. The certificate would be valid for a period of 5 years for those whose disability is temporary and are below the age of 18 years. For those who acquire permanent disability, the validity can be shown as permanent in the certificate. ESA scale. It contains of 6 domains and 40 items: social relationship and reciprocity, emotional responsiveness, speech, language and communication, behavior patterns, sensory aspect, and cognitive components. Scoring system. 5 categories for each of the 40 test items, percentages to indicate the frequency, degree, and intensity of behavioral characteristics. Minimum score is of 40 and maximum can be up to 200. So, according to the scoring system, 5 categories for each of the 40 test items are showed you in front of you. Like if a patient comes and has repeated flapping movements of the hand, so it is asked that to the informant, how often does it happen? Like up to 20% of the time, sometimes, and recording. If you are rating it from 1, 2, 3, 4, and 5, you have to interpret it in the means of percentages. And then further, we have to quantify it with the normal for age of socioeconomic background, may cause for attention and concern, is it disabling, needs an assistance, or completely dependent. And it is more of a subjective test than as an objective test to diagnose a specific disease. This is the test interpretation of the same thing that I told you before. ISA score of 70 is scored as 40%, 71 to 88 as 50%, 89 to 105 as 60%, and so on and so forth. Greater than 158 will be given as 100% with severe autism. Medical authority for the certification is the same as before: clinical psychologist or rehabilitation psychologist, a psychiatrist, a pediatrician, or general physician, as the same case may be. Now comes disability due to mental illnesses. These are the cases that we daily see in our OPDs, which comprises of a substantial disorders of thinking, mood, perception, orientation or memory that grossly impairs judgment, behavior, capacity to recognize reality, or ability to meet the ordinary demands of life, but does not include retardation. Section 2GC3 of RPW Act 2016. Ministry of Social Justice and Empowerment, New Delhi, on 18 February of 2022, issued guidelines for certifying the mental illness-related disability. Indian Disability Evaluation Assessment Scale, IDEAS. IDEAS is a scale for measuring and quantifying disabilities in mental disorders items. It is interpreted through these 5 domains of self-care, interpersonal activities or social relationship with the peers, communication and understanding of the commands given to them and the way they respond back, work, employment, household education, are they qualified enough or they are participating in the daily household activities or not, and duration of the illness. The fifth point, duration of the illness, plays a very important role in further giving the certification and the degree to which a person is impaired. Scoring of ideas. All 4: self-care, communication, interpersonal relationship, and work domains. 0, no disability. 1, mild disability, slight or low. Moderate disability, medium or fair. 3, severe, high, extreme, profound. Total, cannot do. Total score of 4 items plus the score of the total duration of the illness gives us a global score for the illness. If so, the duration of illness comes into play. If it's less than 2 years, score is to be added as 1. If duration is for the past 5 years, added as 2. For 6 to 10 years are added as 3, and for greater than 10 years is added as 4. Assessment method and disability. Examination should be consist of clinical assessment, application of ideas, or an IQ assessment. In cases where a person may have ID, intellectual disability, and mental illness, both shall be used. So these are the percentages of no disability as 0%, mild disability as 40%, moderate disability as 40 to 70, severe disability as 70 to 99, profound disability as 100%. Assessment method and validity. Examination should consist of clinical assessment, application of ideas, and IQ assessment. In case where a person may have intellectual disability and mental illness, both shall be used to score indicating more severe disability should be degree of the person, not to be combined. Validity, there's no mention in the current gazette. Intermediate percentage like 45 and 50% fall into which category is not clearly defined. Rights of the person with disability. According to Section 5, to live in the community, they shouldn't be regarded as a destitute or a patient who can be behaved like anyone with, or should be considered as a lesser than anybody else. Section 6 specifies the protection from cruelty and inhuman treatment of the patient. Section 7, protection from abuse, violence, and exploitation. Complain to executive magistrate or judicial magistrate, or legal aid can be provided to the patient if the patient complains regarding the complaint that he has been abused due to his illness. According to Section 8, equal protection and safety in situations of risk, armed conflict, and humanitarian emergencies or natural disaster management should be given an equal priority to the patient going through a disability. No child with disability shall be separated from his or her parents on the grounds of disability. If a person is diagnosed with a disability, there's no ground that it should be separated from the family members. No person with disability shall be subject to any medical procedure which leads to infertility without his or her free will and informed consent. Section 11, access to all polling station and technology should be provided to the person with disability. Section 12, access to justice, access to court, assisting equipment, methods, means, technologies, and documents should always be considered as an equal and should be given the equal priority. Legal capacity to own or inherit property, movable or immovable. The property can be divided into two brothers if one is have a disability impairment. It is no legal affair that if somebody is suffering through an illness, the property can be divided equally between two siblings. Provisions for guardianship. There are two types of provisions, limited or total. In limited, joint decision between the, if a person is looking forward to get a settled life, a limited decision between the person with disability and the person with whom he is getting married with is full guardianship is not given to him. It all depends upon the patient how much he wants to give the ownership towards the significant other or his family members. A total guardianship is provided, which requires a sufficient support where the patient is not able to maintain his daily activities or requires a severe assistance, after which total guardianship is provided to the guardians. All government institutions and other higher education institutions receiving aid from the government shall not reserve not less than 5%. Before it was 4%. Every child with benchmark disability between age group of 6 and 18 years shall have the right to free education. Section 44, to build any structure disability friendly. Section 91, whoever fraudulently avails or attempts any benefit means for person with benchmark disability shall be punishable with imprisonment for a term which may extend to 2 years or a fine which may extend to 1 lakh rupees or both. Job reservations. Government shall appoint every government established not less than 4% of total number of vacancies. Blindness and low vision 1%, deaf and hard hearing as 1%, locomotor disability, acid attack victims, dwarfism, leprosy and cerebral palsy 1%, autism, intellectual disability, specific learning disorders and mental illnesses 1%, and multiple disabilities. Before mental illnesses were not included in it, but after 2016 Act, the percentage has increased to 5%. Conclusion, basically the importance of the disability certificate legislation passed by the Indian government for disability and different acts how to assess and certify various psychiatric disorders, and the rights that we should be aware of about the patients suffering from psychiatric disorders for their equal participation in the society without considering them to be no less than others.